Okay, our last speaker for this morning is Katharina Simioni, who's the head of marketing for Health Canada. Health, as you know, sort of Canada has a long, esteemed history in social marketing, one of the kind of global leaders in that field. So, great pleasure to have you with us today. Thank you very much.
Good morning, everyone. So Health Canada's social marketing team has led a long legacy of raising awareness and knowledge of specific health issues and motivating Canadians to adopt healthier behaviors. Here's a little snapshot of the last 40 years.
Subtraction, get with the action. Do it.
Making informed food choices can sometimes be challenging for all of us.
So I saw a few smiles in the room. I know that some of those ads probably bring back more memories to some of us than others, but I have to certainly admit it took me down a little bit of a trip down memory lane. So in 1974, the Lalonde Report was published and sparked a turning point in Canadian health policy. It recognized that health went beyond medical care and that health promotion could change attitudes about health. This led to the development and evolution of health promotion in Canada by encouraging people to take more responsibility of their own health. As health promotion grew, so did Health Canada's venture into social marketing. While chronic diseases are among the most common and costly health promotion problems facing Canadians, they're also among the most preventable. Each year, more than 2/3 of deaths result from 4 groups of chronic diseases. Approximately 2.4 million Canadians live with diabetes. Heart disease and stroke affect 1.7 million Canadians. More than 1 in 3 Canadians will develop cancer. And each day, more than 100 Canadians die of smoking-related illnesses. Why is social marketing important to Health Canada? 3 common factors play a role in developing prevention for chronic disease: physical activity, healthy eating, and living smoke-free. Social marketing has played and continues to play an integral part of Health Canada's commitment to meeting the health challenges of Canadians. Health Canada's goal is for Canada to be among the countries with the healthiest people in the world. To achieve this goal, we rely on high-quality scientific research, we conduct ongoing consultations with Canadians, and we communicate information about avoidable risks. We also encourage Canadians to take an active role in their own health. We believe that prevention and health promotion can improve Canadians' quality of life. Social marketing was integrated in our department in 1981 with the mandate of developing social marketing campaigns to inform, educate, and encourage Canadians to make proactive changes in their behaviours for the betterment of themselves, those they care for, and their community. This mandate holds true today. The marketing team focuses on communication component of social marketing in working very closely with our policy programs as well as our program groups to deliver a real integrated approach. We've been in the business of social change for 40 years. Many memorable campaigns have been developed for Canadians, including Participation, a campaign that focused on physical activity, Really Me, a drug prevention campaign targeting youth, Break Free, a tobacco cessation campaign also targeting youth, and Food Safety, a campaign targeting at-risk populations to decrease the chances of foodborne illness, just to name a few. Over the years, we've identified several best practices that make our campaigns stronger. Today, I'm going to highlight a few of our social marketing campaigns and show you how we incorporate these best practices in our campaigns. Let's take a look at our first best practice of applying guiding theories and practices to marketing strategies to target the right audience at the right time with the right message. A perfect example of this campaign that was developed using our guiding theories to reach and connect with the audience is the 2003 Bob and Martin Smoking Cessation campaign. This 3-year campaign used Prochaska Stages of Change model to get smokers to quit. The campaign used a series of 8 TV ads to cover the stages of change. Our target audience were adults that had tried to quit many times before. And with that, we avoided the pre-contemplation stage as they were already there and we just had to nudge them a bit. The framework was ideal because of its ability to communicate with smokers at the various stages of readiness to quit, and therefore bring them from contemplating quitting smoking to preparing them to quit smoking and the importance of a plan, and the perfect Health Canada resource on the Road to Quitting program. Also bringing them from action to maintenance as well as relapse for when they have a blip in the road, so to speak. Using the stages of change model, the TV ads helped smokers better understand the quitting process. It gave them hope and the importance of getting help. It opened their eyes to the fact that they could quit smoking one step at a time, which made it more doable in their eyes. The results of the campaign, the objectives of the campaign were to increase the number of ex-smokers by 2%. And this is tracked through the Canadian Tobacco Use Monitoring Survey, also known as CTMS. From 2002 to 2004, there was a 3.1% increase in the rate of former smokers. Now, while we can't attribute all the results to the social marketing campaign alone, as there were many factors at play, uptake of campaign resources were very impressive. Now, keep in mind, this was 10 years ago, and the internet was not as widely consumed as it is today. But the campaign drove close to 240,000 visitors to the website. Over 180,000 booklets of the On the Road to Quitting resource were ordered, and over 33,000 smokers registered for daily e-quit attempts. Our second best practice is to integrate complementing themes that strengthen our messaging. We recognize that combining complementary messaging, but not exclusively connecting issues to deepen the impact, and that cross-promoting messages provides better reach. One Health Canada campaign to use a holistic, integrated messaging approach was the Eat Well, Be Active, Have Fun diabetes campaign that launched in 2002. The campaign targeted Canadian families with an emphasis on women. A complementary campaign focused on Aboriginal families and communities with the message of eat right, be active, have fun. You can prevent type 2 diabetes. Both campaigns raised awareness of that type 2 diabetes can be preventable, however, tying in the complementing message of eating well as being active. Another example of strong multi-theme, multi-departmental campaign is the Children's Health and Safety campaign that launched in 2010. Messages cover multiple themes across government departments and used various media such as TV, Facebook, and web banners. I mentioned cross-promoting earlier. This campaign is a great example of bringing together several key issues such as transportation, food, consumer products, and health and safety issues. The campaign targets parents with children 0 to 12, and has the objective of increasing the awareness of health and safety issues. We also want to view healthycanadians.gc.ca as a one-stop shop for information and also to increase the number of parents taking simple actions. Post this campaign, one of the results includes 15% more parents checking the installation of their car seats properly. Moving to our third best practice, we'll look at how strategic partnerships extend the reach and improve effectiveness of our campaigns. Health Canada has a long history of partnerships with other levels of government, stakeholders, the private sector, and media. We look for organizations that are willing to commit to our campaigns long-term and also demonstrate the support for the program and campaign goals. We develop partnerships to extend the reach of our messages, as partners have existing channels that can be leveraged, such as their websites, TV, social media, and magazines. We also develop them to add relevance and credibility to our messages. And finally, to create initiatives that meet shared public health goals. A great example of a partnership was the Sudden Infant Death Syndrome, or known to us as SIDS, Back to Sleep campaign in 1999. The campaign objective was to increase the awareness, provide information on risks associated with SIDS, and reduce the risk of SIDS in Canada by 10%. The campaign targeted new moms, mothers-to-be, partners, as well as caregivers. We partnered with Procter & Gamble to incorporate a message onto Pampers diapers on the waistband of their smallest sizes. Educational materials were distributed to new moms through Canadian hospitals and through public health officers. We also reached health professionals through their different associations. The campaign was complemented with TV and print public service announcements, as well as it included on the advertising for Pampers' own campaigns. Now, at that time in Canada, the rate of SIDS was declining, but between 1999 and 2004, Canada observed a 50% decrease in the rate of SIDS. This decline may be attributable in part to the changes in parent behavior, such as placing infants on their back to sleep. The results of the campaign itself were strong. Awareness that back-to-sleep sleeping positions reduce the risk of SIDS increased by 22% in 2 years. Advice from health professionals changed also in 2001, with 67% advising back-to-sleep positions, which was up 46% in 2 years. A great example of a current multi-year collaboration is the Nutritional Facts Education campaign that launched in 2010. Health Canada, in collaboration with the Food and Consumer Products of Canada, known to us as FCPC, and its 34 participating members, including Kraft, Kellogg's, and General Mills, just to name a few, with the objective of raising the awareness about the proper use of % daily value on nutritional facts tables located on packaged foods. Health Canada provided the creative and as well as messaging of the materials, while FCPC provided in-kind contributions, including, this is a big number, so I have to get it right, messaging on over 720 million food packages, with reaching the audience during the buying, while they're making the buying decision. The in-kind contribution also included TV ads, print, and web advertising. Messages were also communicated through their existing channels, such as their corporate websites, their magazines, their Facebook pages, just to name a few. Results: 54% of Canadians who recall the campaign, nearly half of them report having changed their shopping behavior and comparing packages in the grocery store. There's an old marketing saying that it's more important to reach the people that count than to count the people you reach. At Health Canada, we use varied research techniques to identify our target audiences and develop effective social marketing campaigns. Our campaigns can include exploratory research, baseline surveys, focus groups, return to samples, as well as tracking studies. An example of a campaign which uses innovative research techniques is the recent Drugs Not For Me youth prevention campaign. Extensive research went into the development of the Drugs Not For Me campaign. To understand Canadian youth, significant psychographic research was conducted into understanding their awareness, attitudes, beliefs, and knowledges and behaviors. Youth were asked a series of questions about school, families and friends, perceived level of danger of selected activities, so risk behaviors, as well as their usage of marijuana and other drugs. Youth were then segmented into 3 target audiences, one being the straight and narrow, where they have strong anti-drug beliefs, other being the experienced, where they have experience with drugs and positive attitudes towards drugs, and contemplators who may have some drug experience, but generally are sitting on the fence and they're undecided. Our research findings indicated that 40% of youth in Canada fit within the contemplators area, and that made them our target audience. With these findings, messages and approaches, including how we conducted our research, were tailored to youth contemplators to effectively reach them. Another innovative research technique we used with this target audience were focus groups using perception analyzers. What we did was we focus tested 10 TV campaigns from other jurisdictions, including the US and Australia, to find out how our Canadian youth reacted to these ads. Understanding, the types of messages, the visuals, what were the auditory cues, was it music that drives them, and what they related to. Some of our key findings were that they wanted us to show serious but realistic consequences of drug use, messages about progression, escalation, addiction. They really wanted to follow one actor and show how the effects of drugs affected that one individual. They liked the idea of the fast-paced montage type of ads, as well as music really appealed to them. They also wanted to understand what effects specific drugs had on them. The campaign was very successful. It ran from 2009 to 2012, and there was an increase of close to 20% of the proportion of youth who say they know the potential effects of illicit drugs on relationships, friends, and family. And over a 10% increase in the proportion of youth who sought information on how to avoid drugs. And there was a notable increase of 10% of the proportion of youth who decided not to do drugs. Now, this campaign was Health Canada's venture into social media. And the interesting thing about this campaign is it generated a high level of engagement from youth. Our current Facebook page, Drugs Not For Me, has 100,000 fans, and the website received over 100 million visits of youth. I said 100 million, didn't I? 1 million. So sorry. There's the word change. So, next slide. And when the stars align, we see positive changes in behavior to improve the health and safety of Canadians. Very often, to achieve our goals, changes in policy and legislation are required to shape the Canadian landscape. We understand that marketing alone is not the only one that's going to change the behaviors of Canadians. The Secondhand Smoke 2002 workplace campaign emerged as one of Health Canada's most profiled tobacco-related initiatives. The campaign featured Heather Crow, who worked as a waitress for 40 years. Heather never smoked, but she worked in smoke-filled restaurants and was dying from lung cancer. On the eve of the campaign launch, Heather won her case with the Ontario Workplace Safety Insurance Board and made news broadcasts nationwide. The campaign became a phenomenon in Canada. Heather became a well-known spokesperson on secondhand smoke, as well as an advocate for smoke-free bylaws and helping Canada go smoke-free. I remember Heather telling me she wanted to put a face on tobacco. Campaign tactics included TV, print, cinema, and out-of-home ads. Prior to the campaign in 2002, the level of support for smoke-free environments for employees was 72%. Post-campaign in 2004, it rose to 93%. However, attribution for behavior change cannot simply be given to the effects of the marketing campaign alone. This is the perfect example of positive behavior change as a result of changes to policy and legislation, coupled with a strong campaign that touched many lives in Canada, as well as the US. An interesting fact, prior to the campaign, only about 5% of Canadians lived in places where workers were protected from secondhand smoke. By 2006, laws were in place to protect 80% of Canadians. By 2010, smoking in Canada was banned from indoor places and workplaces. Heather died of lung cancer on May 22, 2006, at the age of 61. I'd like to take a moment to share a personal story. I feel extremely fortunate to be working at social marketing at Health Canada for a variety of reasons. But one that really hit home leading up to this conference was a realization of many of the early campaigns made an impact on my life. Now, I'm only one individual standing up here in front of all you, but I've chosen to be smoke-free. I choose healthy foods for myself and my family. I take pride in going to the gym 4 times a week. I guess you could say I'm excited and passionate about the work and believe in the work that we do. I'd like to take this opportunity to thank the social marketers who laid the foundation for the work we do today, including Jim Mintz on leading the path for all of us at Health Canada. Health Canada uses lessons learned and techniques that have been refined over the years, and hopefully our campaigns make a strong impression on Canadians of today. So in 20 years from now, when Health Canada is presenting improving the health of Canadians for over 60 years, hopefully that social marketer presenting can share their personal memories and thoughts of the impact our current campaigns had on them as well. Thank you.